Hello and welcome to the Health Detective Podcast by Functional Diagnostic Nutrition. We bring you interviews from people who have conquered the trickiest of health challenges using the functional diagnostic nutrition philosophy and similar healing modalities. You're going to hear from experts who have been through the ringer with their health issues and yet managed to come out on the other side. You can always visit us at functionaldiagnosticnutrition.com, but for now, here is today's episode. All right, hello everyone, and welcome back to another episode of the Health Detective Podcast by Functional Diagnostic Nutrition. My name is Evan Transu, aka Detective Ev, and I will be your host for today's show. I can see that you guys are excited for this one. We got almost 30 people live with us just from the get-go, and it might be because you know the name of the individual who will be helping us out today. We also know that you guys love this topic of Lab&Learn, so we are so excited to announce this is here to stay. As you can see in the title, this is only Lab&Learn number 4, but you guys have been so excited about the other 3 that we talked with the team and we said this needs to be scheduled regularly. So it is absolutely something that is here to stay. And in fact, we might even be able to find a way to bring this content to you guys weekly instead of bi-weekly. So just know that we're working on that and it shouldn't be a major issue for us whatsoever. Our guest today, if you can call him that, is the founder of FDN himself, Reed Davis. So for those of you that tune in with us regularly, you already know I mention Reed all the time. If it happens to be one of your first times on here, welcome. So Reed, again, is the founder of FDN. I typically host the podcast for us where we interview individuals who have been through crazy health challenges. We also talk about the business of health coaching. And then we also nerd out like this with labs. So Reed, welcome to the show. This is probably your millionth appearance in one way or the other. So it's always good to have you.
Thanks, Evan. Very happy to be here with you and the audience.
Yep. My first quick announcement, if I can, and then I promise we'll get right to the lab, is for those that don't know, we've been having a huge month of events this November. And that's because, let's be honest, in November, specifically towards the end of it, maybe there's usually something that goes on in most companies. And maybe that thing that goes on is advantageous for people who are considering the course. So what we did for you is we created this whole calendar of events. This is where you can learn more about the FDN course. You can ask us questions directly. Reed, Elizabeth, Dustin McFarland, and I just did one yesterday. It was like an hour and a half, 2 hours, and there's still plenty more to go this month. Even if you're not looking into the FDN course for this month of November, that's okay. We'd love to have you on. You can still learn about it now, so you can make an informed decision in the future. And I think almost anyone walks away from it still having gained some insight. We actually had an FDN trainee on the call yesterday. So even though they're training in the course, they were still on with us. You'll see the link on the screen right there. I don't expect you guys to actually type all that in. If you just go to the comments section right now, that's going to pop up on YouTube, Facebook, LinkedIn, wherever you're watching this, you'll be able to copy and paste that link. So I will get that in for you. And I see 35 of you now on live. So without further ado, let's give you what you came for. And I will share my screen and we will go over today what is known as the mucosal barrier assessment. So give me just 1 second here. Thank you so much. All right. And Reed, are you able to see the screen now and the test result?
Yes.
All right, so we'll break down this client a little bit. Obviously, we have blocked out the telephone number, email, name, all that good stuff, but you can see that it's a female who is aged 31. So from what I got information-wise, some of the current symptoms and main complaints we usually say at FDN that this person is dealing with is they have minor bloating. They also have some fatigue that's on and off. They feel that they have some anxiety and depression, although they've never been formally diagnosed. They do feel that they have that. And they occasionally have some acne. Now, one little disclaimer I'll put on all of this before we dive into this lab today is as FDNs, if you're an FDN practitioner that's working with this client, you're actually going to be looking at all of our foundational labs at once. So we would never suggest that just one lab is all of a sudden going to give you every little bit of insight that you need to all of those problems I just listed. But what we do here is we don't diagnose or treat anything. I mean, I'm not a doctor. I can't even do that if I wanted to. What we're doing is looking for the clinical correlations. So we find those things that are wrong with the person. They're self-reported, right? They tell us what's wrong with them. And then we correlate it with the lab results where there is a correlation. And so we will get into that correlation side because that's what makes us FDN. That is what's different than any other place out there. But I think for those that are watching, some of them probably need the lab broken down a little bit, Reed. Obviously, if they want the full analysis, they can take the FDN course. But if you don't mind, could we go through some of these markers really quick and explain to them what they're looking at here? Even like the zonulin. Can we just start with that, please?
Yeah, sure. I think I could feel compelled, depending on the audience and their level of understanding, to say that this is one test out of a number of tests that we would look at almost regardless of the person's specific problem. Like they might have gas, heartburn, indigestion, bloating, constipation, diarrhea, or the famous alternating diarrhea and constipation. That's a fun one. But someone with digestive complaints, you might think, well, I'll run an intestinal barrier test, a mucosal barrier test. And you might even find something like what you see on this lab report here. But if you tried to treat it individually and specifically, oh, look, there's leaky gut, and that's all you did, your chances for total success with that person would go down dramatically versus looking at a whole number of lab reports and fitting all the pieces of the puzzle together. So I want you to look, even though this has 3 markers on it, plus a ratio between 2 markers, it's really just one lab out of several that we want to use to look at how, what's a person really doing. So we identify this whole constellation of healing opportunities. That would include their hormones, their immune system, digestion, detoxification, and other ways of looking at a person. So that, because look, they've already been to a doctor and been checked out, maybe even a functional medicine practitioner that already ran a stool test, found out they've got this wrong and that wrong. And then those things might even be getting treated. So the diagnosis and treatment model, in our opinion, is to be avoided. Well, so why do we even run labs then? Because they identify healing opportunities. In other words, this is what's really wrong with the person. This is what needs to get fixed. Because there's so many ways to band-aid the symptoms, and Evan just named a few. I named a few more. So I would want to know about the person, like whose test results are these? That's really, really important. And so here we have a young person who's got some complaints, and we don't really care what some other practitioner has labeled that person as having. So in other words, the diagnosis, not our concern. What's really wrong? And so here we're getting a look at a few markers: zonulin, histamine, and diamine oxidase, the DAO. And of course, the ratio of histamine to DAO is important, or can be, depending on the person. So the zonulin is basically playing a role in opening up the tight junctures inside the gut. You know that in the gut, and by the way, I love my graphics, and I don't have any screen sharing ability today, but just bear with me for a minute as we try to actually picture what's going on inside this person's small intestine, where you've got food being absorbed, hopefully the way it's supposed to be absorbed, through the small cells on the lining of the gut, lining of the villi. You know about villi. So the villi are lined with these cells, epithelial cells, and food should get absorbed through those cells. We call it intracellularly, and that's a good thing. So we'd want, now what happens in the gut is you get dysbiosis. So in a gut, and by the way, we'd love to show you another test that would kind of lead, like the dominoes are following in this person who's got stress, and stress affects their immune system. The immune system starts to fail. In other words, they get what's called a dysbiosis. So inside the gut, you've got this dysbiosis going on, and you've got disruption and interference going on with normal digestive process. And what happens is these sort of bad bacteria, and it doesn't have to be anything really bad. It doesn't have to be some virulent bacterial infection. It is out of balance with the good bacteria. That's why we call it a dysbiosis. So you got this dysbiosis happening, and those unwanted bionts, they start attaching to the epithelial cells and stinking up the place, and it gets very disruptive. And you start to have some of these bionts slipping through into the lamina propria, into the further deeper into the gut. And so zonulin is and here it's FP, family of peptides. These are small amino acid chains that are at work when we need them. And what they do is they actually work to open up the tight junctures, which is the space between these epithelial cells. It opens it up on purpose. Why? To flush out some of these unwanted bionts that are causing immune system problems and reactions and all kinds of things. So you have zonulin being measured here. This one is in yellow, so it isn't particularly, real high or real low. Now, again, it matters whose test result this is, because that would perhaps tell us which direction. Remember, these are moving targets. So which direction do we think that zonulin's going in? And it may very well be headed, what I would call is north towards the 13 on the right. So we see that there's green on the left, then it goes to yellow. So green would be sort of a quiet level. So the zonulin isn't particularly active down in the green. Here it's going up, it's moving to the right, which tells you that, hey, those tight junctures are opening it up in reaction to something, likely a dysbiosis. We'd love to see the other tests that this person ran. That's why all our tests react or interact with other lab reports. We don't just run one test. But here, Evan asked me to zero in just on this marker. It's a really good marker. We use it to tell us if the tight junctures are opening up in a person. Now, is that a bad thing? Well, not at first, because it's just releasing you. The tight junctures open up to flush out. It's actually trying to help heal this person who's got some permeability issues. Those bionts, the unwanted bacteria, has disrupted that single layer of epithelial cells. So it's flushing out. So we would say, hey, you've got something being flushed out. It's not over to the right. The zonulin here is a 9.6. That's nanograms per milliliter, which is not super, I don't like using the word super bad, but it's definitely reactive. So that might explain why the person feels so lousy, which is the key to running this kind of labs. Would that explain why the person has some digestive symptoms, if nothing else? Now, it could get a lot worse when it does get up around the red. Now you're looking at a true super leaky gut. And it isn't any longer just flushing out some of these unwanted bionts and other immune complexes and things out back, flush them. Hey, these are getting through into the body. Let's flush them out back into the gut lumen so that they could be, excreted through eventually feces. They go down the small intestine, end up in the colon, end up being pooped out the other end. So yeah, we want to flush those things out. So this one here, yeah, it's flushing out some things. There's probably a dysbiosis, and that could explain a lot about why the person is feeling so crappy. And by the way, this is a finger stick test. So that means the person pricked their finger with a little needle and a little poker, and you drip blood out onto a blotter. And it makes it real cheap, makes it real easy to do. And you're going to then send the dried blood spot, it's called a blood spot test, or DBS, dried blood spot test, send it into the lab. They reconstitute it and do all their testing work. And they send us this report back, which is telling us a lot about this person. So far, so good, Evan. Did anything pop up? I can't see a chat window or any of that
Yeah,
stuff.
no problem, Reed. I got you. And so normally they wait till I invite them. You'll be very happy to know we got 53 of you live with us right now. We're so
Yeah.
happy to have you and that you guys want to nerd out like this on a random Tuesday.
Yeah.
So thanks for being here. Please feel free to engage with us in the chat. Ask anything you want as we go along here. I will prioritize relevant questions just so that it stays, coherent with what we're presenting. But yeah, we love your guys' questions. Any Lab and Learn, please feel free to come in and ask stuff. Last time when we did something with Whitney, most of you guys didn't ask anything till the end. We want you to know, Reed, Whitney, our other clinical advisors, Paula, these people are very advanced in this stuff. There's no stupid questions. You don't have to feel scared about asking something. We're never going to say that's a bad question. We just might tell you it's not a good question. No, I'm kidding. So we won't do that, but please put it in the chat. And also, shameless plug, make sure to subscribe, guys, as well. We do Lab and Learns multiple times a month, possibly even moving to once a week soon. We do business training for health professionals and live health interviews as well. Read one follow-up I had for you on the zonulin specifically. And I'm sorry, I don't actually haven't talked to you about this yet, so I don't know if you're familiar with this or not. I believe it was Dr. Tom O'Brien. I think he shared something about this. People, when they hear the zonulin marker, if they're in our space already, most people think about it as a marker on stool tests, specifically an optional add-on for things like the GI map. People see those things there. Now, what Dr. Tom brought up is he believes, and we love the GI map, by the way. It's one of our foundational labs at FDN, but the zonulin is an optional add-on. One of the things I believe it was him saying is that the zonulin for stool, when you measure it that way, it's very short-lived, and we don't necessarily get an accurate assessment of that. Do you know anything about that offhand, or why it would be better to run zonulin with this blood spot as opposed to stool?
Well, for a number of reasons, and I guess the bottom line would be how accurate is the stool test compared to the blood test. So we think the blood test is superior and prefer that. That doesn't mean that the zonulin marker on a stool test is useless, but it's more of just a screening. And if you did find a high zonulin on the stool test, you'd want to follow up with a sort of a more pinpoint type of test.
Sure.
So the stool test I would call a screening. This I would call a test. And say, hey, look, that's the actual level in the bloodstream. So it's closer to the actual problem rather than have, as I previously described, you flush this stuff back out into the gut lumen, and it passes through all the rest of the 21 to 27 feet of small intestine. Then it's got to go through all of the colon before it comes out your butt as poop. And that's where you could measure it, but it's gone through, it's done a lot of traveling throughout the body before it gets there. So we think that the blood test is going to be more accurate and more real time as to what's going on with this person.
Very cool.
It's a very fair and great question. Again, the screening on the stool test would probably lead me. It depends on what else is going on. Again, we don't run one test, and not trying to diagnose, gut hyperpermeability specifically. We're trying to see what part that plays in this person's overall health picture. Again, in FDN, we don't diagnose and treat anything specifically. We help that person treat everything non-specifically. Our protocols have an effect on every cell, tissue, organ, and system because we use epigenetic forces. We use the laws of nature to create healing in a person. So treating one thing specifically, that leans towards medical, which we don't think works as well as leaning towards holistic and the whole person approach. So we've gotten better results with that over the 25 years that I've been doing this. And with that, I'll probably go back to the test here.
We do have a chat question if you want to go to that real quick.
Okie dokie.
It's just their YouTube name, so it says AHB. So I'm sorry that I can't address you by your name. And you'll be able to see sorry that it blocks your video real quick, but you can see the question.
It's a great question. I see it now.
Yep, cool.
So if the zonulin marker was in the green, would you assume no barrier? Sure. I would never assume anything because testing is testing, and there's lots of other tests. And remember this, and AHB, I'm sorry I don't know your name, but all causal factors have to be considered. So what are all the causal factors? involved. So is zonulin, whether it was high or low, is that the problem? Or is that the result of the problem? So I want to tell you that lab reports aren't the problem. And that's why we don't just immediately prescribe some agent to change the test results. What we want is to find the underlying causes and conditions and change those so that the test results, in a sense, would self-correct. So here we have zonulin at a fairly, it's kind of borderline, but which direction it's going in, well, you'd know by if you knew the client. If you knew the client or patient, you'd say, hey, this lady is headed south. It looks like it's going bad. And I want to point out here that if the black diamond marker, and kind of in the middle of the yellow there, the 9.6, if that was far to the right, let's say above 13, it would generally, if you have just a diagnosis mindset, tell you that, yes, this would be a real barrier issue. So we have a mixed result here. Yes, I think there's a barrier issue. Remember, it's up to the clinician to interpret and make the call. So it isn't just as simple as, oh, this test says this and this one doesn't. Like you asked, because it's in the green, could it be that they don't have a barrier issue? Yes. And that's why we need the other markers. Now, by the way, look at the zonulin bar there, the bar graph,
Mm-hmm.
and look to the very far on the left. It's also red. Do you see that? See how the very far tip of that zonulin is also red? So what that tells you is that no zonulin is also bad. You want these things to be hovering, just like the immune system. Why do you have any bad bacteria at all? Like it's in our training, and it's common knowledge in our world, alternative health especially, that about 80% good bacteria and 20% bad bacteria would be a normal, healthy ratio of the bacteria in the gut. So we're up in the lumen, which is the tube that food goes through. So when you're up in the lumen where food goes through, you have a lot of bacteria, 80% good, 20% bad. That's normal. Why would you want any bad bacteria there at all? You'd want that there to keep the immune system hovering. Because if there was none, the immune system would go away. It wouldn't be needed. And then when you did get something coming down the pipes that was, let's say, bad for you, just using these rough terms, well, the immune system wouldn't respond as quickly, wouldn't respond as appropriately. They say strong a reaction. So you need good and bad bacteria, in the gut lumen to. The bad would be keeping your immune system hovering, and this is part of it. The zonulin is sitting below the surface a little bit, on, let's say, on the other side of the epithelium, waiting to open up those tight junctures and flush out anything that happened to, I just call it worming its way in, no pun intended. Because besides the bacteria, you have parasites, you have funguses, you have biofilms, you have lots of sort of nasty things that could come down the pipe, right? So
Mm-hmm.
here we see, is something being flushed out here? I would say, yeah, knowing the client and knowing the other lab reports that told us what's going on with that dysbiosis, I'd say, yeah, you definitely have a mucosal barrier issue here. And we could talk about the mucosal part of that, but that's not what this is for. So the next thing that might back up our assessment is the histamine. So I'm thinking, yeah, this looks like leaky gut to me. Maybe not really bad right now, but it's headed south. Why? Because the histamine is really high. So and so when histamine is real high like that, histamine also comes out of the lamina propria. So it's not in the gut lumen. It's not out there with all of the food and bionts and mucus and all the other things. It's inside on the, let's say, the interior of the body part of the epithelial cells. So it's also, and it's being produced, by the way, by mast cells, which are reacting to something. So now it could be that it's food they're reacting to, or it could be worse than food, like unwanted critters. Let's just call it that for now, or unwanted um, uh, other elements that raise your histamine. Now, most of you know what histamine is because you might even have some allergies. Histamine is it's very sensitive and it can respond to things, not necessarily allergies, but if you're allergic to a dog and you start petting a dog, generally speaking, you'll get a high level of histamine. You'll get a histamine reaction. This is what turns your eyes red and makes them itchy. It makes your nose run. You get scratchy and things like that. So histamine's that kind of a thing. And again, we're not trying to diagnose anything in particular here. We're just saying, hey, look, histamine's gotten involved. It tells you further how dysfunctional this gut is getting. And then what would be nice if we had a bunch of different ones of these, I could give you different examples. But the counter to histamine is diamine oxidase. That's an enzyme that breaks histamine down. So if you have histamine kind of leaking along with the zonulin into the gut, and it's just generally, again, stinking up the place on both sides of the fence, so to speak, well, you've got this DAO to counteract it. DAO, diamine oxidase, is made in the crypts. It's made in the little tiny places between the villi. So now here, and again, if you look at the bar graph, it's red on both ends. Why is that? Because no diamine oxidase would be bad. It means your crypts, the little spaces between the villi are probably really dysfunctional. They're damaged. Or if it's real high, so no DAO is a bad sign, and real high DAO is telling you what? It's reacting to something. It's probably reacting to high histamine because that's what it does. It's there for that. So here, now if you can scroll down just a tiny bit for me.
Absolutely. I'm actually going to zoom it back out just a little bit to help as we were.
There is good. So that's why we look at the ratio. So without the last bar, the fourth bar down, without that one, you'd see high histamine, and you'd think, oh, reactivity, either allergy or some kind of sensitivity, or they might have eaten a bunch of histamine-containing food. But generally, we know from their diet that that's not true. And people who are histadelic, in other words, sensitive to histamine, they know what foods not to eat for the most part. At least we hope they do. And we can test for that. So again, a lot of moving parts here, but when you look at the histamine, oh, it's high. Where would we like the DAO to be? Well, at least moving up pretty high to counteract the histamine. And it's kind of a weird thing, but you see the chart going the other way. High would be to the left for DAO, and low would be to the right. It's just the way the lab reports stuff. We don't own the lab. We have some influence. Matter of fact, we helped them to put this together. It's what we thought would be appropriate to use in FDN as a non-diagnostic, very, very functional test for gut health. So we're looking at zonulin. Yeah, it looks like it's moving in the wrong direction. You're flushing out some bad things. And if I didn't mention it, if it keeps flushing and flushing, then it becomes a two-way street, and more bad. It just gets worse from there. More bad things are going to start leaking into the interior, and they'll get caught up in the hepatic portal system, go right to the liver, congest your liver, which is another marker we love to look at, liver congestion. And again, I'm not able to go through all this in this short of a venue, but it's really fun to go and look at the anatomy and the physiology and the biochemistry behind these things. Because remember, we're trying to find out for this person here who came to us for help. By the way, they might have been told by their physician, nothing's wrong with you. Your standard blood work looks normal. That's, I'd say, Evan, what would you say on a scale of 1 to 10? How high up that is, like in common complaints? Don't you think it's,
Reed, it's the reason I came to FDN. I always tell people this. I had 7 different diagnosed conditions at 18 based off clusters of symptoms, right? So I actually
Yeah.
was labeled with these diagnosed conditions by doctors. But when we did the blood work, the only thing that they told me was that my cholesterol was slightly high at the age of 18. And
Mm.
if it is your first time tuning in, just to be very clear, because we say this all the time, but if you're new, you wouldn't get it. I understand that. We are not against Western medicine in any way, but when you treat every problem like a nail and all you have is the hammer, it's people like me can unfortunately kind of get screwed by the system because how ironic is it almost to label someone with these conditions? So you're actually, in one sense, telling me something is wrong with me, right? Because you're acknowledging I have these diagnoses. But then I'm like, well, what can I do about it? Well, we have medications, and then one of my conditions would have needed a surgery eventually. But then I did the FDN foundational labs read, and you've had to hear my story a million times. The bottom line is every single one of the foundational labs that I ran with FDN had multiple healing opportunities on them. None of them showed nothing. I had actionable steps from all of them. So it really is a huge difference for people that are in this system and kind of getting told nothing's wrong. I would say 70-80% of people have had that experience in our community.
Exactly. And that's where I started 25 years ago in the office. And I had a lot to learn, but I had nothing to unlearn. I hadn't learned a diagnosis and treatment mindset. I just wanted to know what was wrong with people. And that was the job I had at the clinic. And I ran thousands of labs on thousands of people. And I had great mentorship, of course, by the lab directors and geeks that worked there, lab rats, I used to call them. And they taught me a lot, but not about diagnosing, because they weren't doctors either. They weren't allowed to diagnose either. Just what's really wrong. And what the phrase I came up with was healing opportunities. So far, we're seeing some healing opportunities here. Again, not medical diagnosis where you just write a prescription for high histamine. Sure, there's plenty of that going on. Like if you're allergic to dogs, you're playing with a dog and you get watery eye, they can give you a pill for that to lessen the histamine response. Me, I would just get rid of the dog, but really, I had a cat. Never mind. So this diamine oxidase is also, I would say that it's headed south, because if histamine's high, in other words, the black diamond is over to the right, diamine should also be kind of high to counteract it. So what you see is the diamine oxidase actually sliding to the right. I think it's sliding to the right. Telling you what? Well, it's becoming more and more dysfunctional. Now, when it gets all the way over to the right, your villi are damaged. You've got hyperplasia of the crypts. The spaces in between flatten out, the villi flatten out or get shortened, and your brush border is gone. There's lots of little parts, and it's so fun to do the physiology and anatomy behind this. But if you are confused by the histamine, the DAO, because these aren't crystal clear cut here.
Mhm.
That's why we like the histamine to DAO ratio. And you've got it going up. So I think that you got too much histamine compared to the DAO. You would want that to be down in the green, where there's histamine, but you got plenty of DAO to counteract it. And remember, these things all come and go. They're coming and going, coming and going, coming and going, based on what the environment has in store for you. Like again, the dog, or you eat a food, or you something raises your histamine. And so this is just one little bit deeper look into the mucosal barrier, and which is the other thing I would have to say about the stool test. Sarah, the DAO stands for diamine oxidase. Diamine DA oxidase, which is an enzyme that
Thanks, Sarah.
breaks down histamine. Good question. So you see here that the ratio is climbing, we think. Again, I'm able to make that statement because knowing the client, knowing that they're getting worse in their symptomatology and all the other lab reports that we would look at. We never just look at this one test. It's telling me, things are getting worse. So that means they need to change something, and you're welcome. So, and we can apply healing strategies like finding out what foods they're sensitive to. Maybe even looking at some of the medical tests. I mean, some people have been to the doctor and they have found allergies and different things like that. But we're going to look at all of the functions together and get this person on a path of healing. And that includes eating right and going to bed on time and exercising. You've heard of that. Stress reduction. And that stress reduction would include, well, the food test is actually great because it would get rid of some foods they're sensitive to. And there's other ways of looking at stress, like chemical stress, environmental stress, all kinds of things. So huge stress reduction, especially finding out what they're sensitive to, what's pissing off their immune system here and causing this. And we see that as plain as day on these test results when you get the right training, when you know what to look for. Anything else that you can think of?
Yeah, well, one thing I wanted to know for these people to have kind of the perspective on, and by the way, guys, I'm going to have an event pretty shortly after this, so you got about 10, 15 more minutes to ask questions. And if you don't mind, I will ask this at this point, just so we know if this is the content that you want us to continue with, because I'm guessing since there's now 60 people on, you guys are liking this, that's good. Could we drop just, hey, we like this, or hey, thank you, Reed, in the chat, if you like it, but maybe you don't have questions, because we don't want to give you guys stuff that you don't want. So if you like it, but don't have questions, just a thank you in the chat for Reed would be awesome, for him hopping on and being a part of our Lab and Learns. One thing I wanted to ask you though, Reed, for the audience here is, if I'm them, I'm thinking, all right, histamine, wait, this is a snapshot in time. What if I was around the dog that day and I know I'm allergic to dogs or whatever? So would we advise the client that is taking this test, would we want them to be away from known triggers? You know, if they know a certain food gives them a runny nose, should they be eating that on a day that they're taking this test, or what would be the best course of action for that?
First of all, scroll up just a tiny bit. I want the top bar to be fully illustrated there. That people looking who just joined us would know that's zonulin. So remember, zonulin comes and goes. It can appear and disappear actually in a matter of minutes, but more likely, an hour or two. It can do its job. It's actually not a bad thing. It can do its job. But when it's chronically assaulted by these unwanted bionts, which are affecting the mucosal layer and the epithelial cells themselves, you're breaking up and stinking up the place. Well, it'll just keep flushing and flushing. And if you got histamine along with it from some reaction, that's your immune system also talking to you. And then the DAO is kind of a regulator or suppressor for the histamine. And there's a natural balance that should be there. Well, this is out of balance. And so you can run all these tests on someone who's pregnant, of course. Pregnancy is actually the best time in the world to nurture a person. I mean, if you think about it, you're eating for two and everything else is affecting two. So it's a time to nurture. Bathe yourself in nurture. Bathe yourself in nurture when you're pregnant. And that would be nutrition and all the others, rest and all the things that we do. I just saw that in the thing and I had to mention.
Oh yeah, no, that's why I popped it up for you. That's all good. Thank you.
Yeah. So what was the question?
Well, the question that I asked, I was asking about best protocols or practices for, if we're going to take this test, and histamine, like many things, is a snapshot in time, would a client be advised to avoid known triggers of a dog or whatever?
Well, would it affect the test results? It could. Yeah, of course. And so there's some expressions we use around the testing. Some require a challenge, and others you don't want any challenge. For instance, our food sensitivity test, it's called a mediator release test, doesn't require a challenge. That test can identify whether that food is creating an immune response or not without having challenged it, without having eaten any of that food. You may have never even tasted that food, and yet it's going to have an effect on the test results. So other tests for foods like IgG testing and these other ones, they require a challenge, because if you haven't eaten it, it won't raise the antibodies.
Mhm.
This test is kind of excluded from that. Although if you're allergic to dogs and you were around a dog, you probably expect some high histamine.
I'm
Um,
thinking of
yeah,
sorry, I'm thinking of as well, like with our hormone test, just to give these guys another example. This is just little stuff that adds up over time when you do it right and you're an astute practitioner. If we're running cortisol test, well, it's a hormone test, right? That includes 4 cortisol samples throughout the day on a client. We want to make sure that they're not sitting there doing a 4-hour workout or having, a fight with their spouse when that's not normally how they interact with each other. These are like the little things that FDNs are trained in, amongst many other things, because you don't want inaccurate lab results, right? If you ran a 4-hour or did a 4-hour workout that day and you don't normally do that, that would obviously give you a spike in some of your hormones that would not normally be happening in your life. So that's, anyone can look at it, or anyone can run at a test and anyone can look at it. But what we train people to do at FDN is to look at them well and look at them intelligently and look at them in context to the person that's in front of us. I think that's really a common theme of what Reed's been trying to get to today is, yes, anyone can run the lab and you can look at the markers, but not everyone understands the nuance that's leading to what's going on here for this bigger picture. So that's what we do as FDNs. So sorry, I didn't mean to cut you off. I just want people to know that this
and so there's some unique or distinctive, at least, things about FDN and the way we look at labs. And it always goes back to whose lab report is this and how are they presenting? So here we have a 31-year-old female, mild acne, bloating, fatigue, anxiety, depression. Well, those things have multiple causes, and that's why just labeling it anxiety, depression, here's your pill, or here's your pill for fatigue, or here's your pill for bloating, here's your pill for acne.
Mhm.
There's lots and lots of pills. You might end up on 3 or 4 pills for some of that stuff, and it definitely can make the symptoms go away. But if you aren't looking underneath, and sometimes very far upstream, I like to say, then you're going to miss the boat. You're going to be on those things forever, and you're never going to heal. And by the way, that is a downward spiral that only gets worse in time. You end up needing bigger, stronger, I call it the symptom removal stick, so to say. So now, but in any time here, I'd love to look at some more lab reports, but let's just pretend that zonulin was really high here, and histamine, let's say, was also really high, and diamine oxidase was real low. And remember, diamine oxidase, just like histamine, the chart there, that little graph is red on both ends. So having a lot is not good, which, by the way, you'd see most likely that the DAO would be high in fresh, sort of new cases. Like early on, before gut dysfunction has really set in, you probably can make a lot of DAO. And here, you're, again, this is what I'm trying to express. You're seeing the health of that, the functional health of that system. Histamine is high, right? It's far over to the right. Why isn't DAO also high? That's the best the body could do in this day and time right here. That's the best it could do. It's cranking it, but not to the level that we want it to. Again, when I think it's probably sliding downwards, which is to the right, would further increase the ratio. The histamine DAO ratio would continue to go to the right along with it. And so, again, these are healing opportunities. It's what's really wrong. And then it would be what kind of strategy we need to put in place. And it's a self-healing strategy. We don't write prescriptions for drugs. We get the person to, again, eat right, get lots of rest, exercise, reduce stress in every way it could be identified. And here I would call a lot of this stress. You want to hear something else interesting?
Sure.
Well, stress affects mast cells in the lining of the gut. And so you end up with this mast cell activation where it's just cranking out the histamine and other parts of the immune system that, again, I would just like to say stink up the place. Very medical expression, right? So, so we know what's wrong with the person, especially with the other lab reports that would go around this. Frankly, I'd like to see an indican, which would tell us the level of their dysbiosis. I'd like to see a urinary bile acids, which would tell me how congested the liver is. Because, and let's go there. I'd also want to see oxidative stress. We use 8-OHDG, which is a really good marker for oxidative stress. And so, what happens, let's say, past this? This person only has their symptoms were anxiety and depression, bloating, fatigue, and so on, right? So, so when you, what's after that? What does the downward spiral look like for this person? Well, pretty soon the zonulin's going to be high, like all the time, and the histamine could stay high. The diamine oxidase is going to go down to nothing because you've destroyed the lining of the small intestine, the epithelial cells. You know, the villi are blunted or shortened. The crypts, which is the little space in between, has flattened out. You're not making your DAO. Well, now you've got a true leaky gut. So here you're looking at headed there. Isn't that wonderful that we could catch this when the person's having their early symptoms? This is before they've got colitis and Crohn's and irritable bowel syndrome. You know, they're not that bad yet. They haven't been diagnosed with all those horrible things. Not yet. So we're catching it real nice and early. But the next, besides all that going on in the small and large intestine, you've got what's going to go through into the body, which is why the liver marker becomes so important. Is unwanted particles, food and immune complexes and all kinds of things getting through into the hepatic portal system, meaning it's coming off the digestive tract, now going to the liver. Now, food's supposed to do that. It's supposed to come in through the villi, and large fats go through the lacteals, and there's nerve supply. There's all this stuff going on. But so it's food's supposed to go through the liver to be basically purified, let's say, and detoxified. And the liver also manufactures a bunch of stuff. But if we see our liver marker on top of this, what you're seeing here, this is damage. When you start to see the liver get congested, it's worse. And now you have another healing opportunity. Oh, well, not only do we need to clean all this up, but we need to clean up that liver too. It's congested. You got bile acids spilling over into the bloodstream, and they're easily collected in urine. And so we can look at the urine test and see those bile acids in excess. And that's never a good thing.
Reed, real quick, because we're going to have to hop off in a second. I have something in the graduates group. We're going to take Sarah, your last question. Before we take that question, first of all, thank you guys so much for being here today. This was awesome for Reed's first Lab and Learn, so many of you. But I want to ask you to put something in the chat for me really quick, not just to thank you, but could you put in labs that you would love us to see us review on Lab and Learn, because we got clinical advisors galore at FDN. We got people that can do just about anything. So let us know what labs in the future you would like us to review. We will always go over our foundational labs. They're always going to be a priority here. But if there's anything else that you'd like to see, please let us know, and we will have some people analyze that. So drop that in the chat for me if you would. And then Reed, let's get to this final question here if we can before I got to jump. Sarah had asked, where's the line between leaky gut symptoms and those of MCAS? And for those that don't connect that, MCAS is mast cell activation syndrome, which Reed has been talking about.
You know, the symptoms are very much alike. So you can have the itching and the hives, which look like a histamine reaction, swelling, gastrointestinal issues. You can have the heartburn, gas, indigestion, bloating, diarrhea, constipation, all that sort of stuff. You probably get with the true MCS more of the abdominal pain. You might be in a little more pain. You might get more, because remember, zonulin is highly involved in interacts highly with the brain and with the lungs. And so you could have the wheezing, shortness of breath, things like that. You can even get, again, along with the brain, neurological symptoms, headaches and brain fog and all that kind of thing. So as to whether there's a distinct line, Sarah, I would say it doesn't matter. Not. I would say no. I mean, they're just different evolution of the same major concerns. You know, it starts off with stress. Stress affects your cortisol and DHEA balance. You end up in a catabolic state. People in a catabolic state, their bodies are breaking down. And not only do their sex hormones go out, and we could do a whole show on that one. Well, the next thing to fall, as the dominoes fall in stress-related chronic downward spiraling conditions, you got this catabolic condition, body's breaking down, you're aging before your time, your skin, your hair, you're overweight, you're foggy thinking, you got fatigue, you got poor sleep, you got low libido, you got inability to build muscle. You know, you get these conditions going on. And let's not even talk about blood sugar problems. Let's just keep it right here in the stress-related hormone immune, digestion, detoxification issues. Keep it local to that area, and you're seeing some markers here that could give you insights that you wouldn't get from any other testing. Mm-hmm. And you know, this test, by the way, that you're looking at isn't even a medical test. It's considered a RUO, or research use only. Well, it's the kind of research we want to be doing, which is the underlying causes of conditions that are way upstream before you even get to the symptoms. Matter of fact, this person right here could be asymptomatic, and yet, or this mild, vague symptoms, they're not really sure, and you know, I just don't feel right, kind of stuff. And again, they've been told by someone who ran blood work, nothing's wrong with you, everything there looks normal. Or like Evan when he was 18, oh, you got a little high cholesterol, but otherwise you're fine. Well, he felt like crap. He had bad acne. He had, you know,
I'm like dying otherwise.
yeah. Felt like jumping off a bridge and all these different things. But your blood work's normal. Well, that's great. So what? Do you just take a chill pill then, or what? You know, so this is the kind of lab work that goes upstream, and we're happy to present it. You know, 8 weeks from Sunday. I'm excited to be part of this. Yeah, I am the founder of FDN, but all that means is I've been doing it longer than the rest of them. You know, we got really, really smart people coming through the FDN course, and it's not just health coaches and sort of interested parties. A lot of people take it for their own health, and that's worth the price of admission. But it's for any practitioner that wants to learn a very fundamental approach that's anti-diagnosis and treatment model. You know, we're not in handcuffs. We're not bound by our state licensure that we have to follow the strict standard of care. We actually, I'd say, care about what's really wrong, not what label you can give it, and to be able to, or actually forced to write prescriptions and that lead to surgery and things like that. I know I'm just sort of talking randomly, but it's really important what we do. We're such a different movement and way of thinking. Like, I can honestly say, I don't care what your diagnosis is. I want to know what's really wrong.
Well, the good news is my boss can't be mad at me if I'm late for the next meeting because I'm with him right now. So it kind of works out.
Go ahead.
I really do have to hop off, though. We got another live in 4 minutes. Reed, thank you so much. Thank you, everyone who tuned in. Please make sure you're subscribed. I'm not trying to be that cheesy YouTuber that asks that, but if you like this content, we're doing this multiple times a month. We have incredible interviews with people who have been through health challenges that were told were incurable, and then they're on these podcasts and they don't have symptoms anymore. And we also do a lot of business stuff for health professionals as well. So subscribe, turn the notification bell on so that you know when we schedule these, so you know what day to tune in.